Thank you very much for the invitation to be here today and to speak to you. And I bring apologies from Catherine Lowry, our Mental Health Commissioner of New South Wales, who isn't able to be here. So I'm the stand-in. I'm actually one of 6 part-time Deputy Commissioners. The others are Daniel Angus, Jenna Roberts, Tim Heffernan, who I know you would know, and Tony, whose name's gone out of my head, from the South Coast. Anyone help me? Garrity, thank you very much. One thing I didn't put in my notes, Tony Garrity and Tom Bridson from Central West. A proud Wiradjuri man. So I'm one of the group. We call ourselves the Community Advisory Board of the Commission, and we meet quarterly. As well as you would possibly know, we have a Community Advisory Council that is a wider group of people, and they meet quarterly as well. And you can see on the Commission's website, you can see what we're doing, you can see communiques from those meetings and connect as well. So I'd like to start by acknowledging the traditional owners of the land on which we're meeting today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging, and celebrate the strength, resilience and wisdom of Aboriginal people who own this land, on this land which has never been ceded. I also acknowledge people with a lived experience of a mental health issue and the lived experience of carers, families and kinship groups. The Commission, as you would know, is really built, and I'm sure John Fennelly would have made this point yesterday, is built on the foundation of listening to and understanding and amplifying the voices of lived experience. And I understand that John spoke about his personal journey a little bit yesterday, and that's fantastic, and great that he was able to share that with you. My own journey is a different one, of course, and I'll tell you a little bit about me when I get to that point. So the Commission, as I said, is committed to amplifying the voices of lived experience. We value and respect the wisdom and experience and bravery, and absolutely are committed to ensuring that lived experience is at the core of everything we do. And we do that very actively, and any of you who've been involved in being part of a focus group or a project with the Commission, I hope, would have had that experience, that sense of lived experience coming first and being the foundational voice. Because together we seek to work to ensure people's rights to live meaningful, healthy lives, free from stigma and discrimination. So thank you, Being, for the invitation to speak at this important event today. And it's my privilege indeed to be in a room full of peer workers. It's so wonderful, as I look back, which I won't do long, to see so many people working in the field now as peer workers. And I'd really like to get a sense of, and I hope you don't mind, but how many of you are working in the New South Wales health system? Oh, isn't that wonderful? Fantastic. So we've got a long way to go still, but that is fantastic. Who's working in the not-for-profit sector? Yay, not-for-profit sector. And is anyone working in another government sector like community services or? Yes, great. That's an area of growth, isn't it? As we look at the future, we've got to do more. And anyone else working in an area which I haven't mentioned? Yes. The private sector, great, fantastic. In private hospitals? Private clinic, okay, fantastic. That's another growth area, isn't it? Yeah. Yes. Volunteer, okay. Whereabouts are you volunteering? Oh, excellent, great. Well, it's, yes.
I'm on ACON's...
Oh, you're on the pilot.
on the, how do I say this? Rainbow Lived Experience Mental
Yeah,
like,
great.
as a LGBT.
Yes.
So on there, and the commission has
We've got a pilot going with
yeah,
ACON. Yes, I'm going to mention that today. Yes.
so
Yes, good. Well, thank you very much. That gives me a great sense of the diversity in the room. And as I say, it's, when we, not too many years ago, we had much smaller numbers, of course. And it's been my great privilege to be one small part of the growth of peer work in New South Wales and Australia. So just a bit about me. I've been in the sector for a long time. I had a long career in the public sector, and I think you might have heard a little bit about this yesterday. But my most valued and valuing contribution was as CEO of Richmond Fellowship New South Wales and then Flourish Australia, and where we were able to with great leadership from extraordinary consumers, particularly Janet Ma and Faye Jackson, who certainly went the hard yards, and of course Peter Farrugia, who went the hard yards to educate me as the CEO about what needed to be done, and stood up for what needed to be done. And so we were able to really grow the peer workforce in Flourish, and I think Peter is going to talk a bit more about what's happening now this afternoon as part of a panel. Now, I do know language is important. I know that there is a lot of debate about the terminology around peer work, and that the national lived experience guidelines and that process have added and wanted focus on the term lived experience peer work. I acknowledge that. I'm just going to, for simplicity's sake, talk about peer work and peer workers today, but I do absolutely acknowledge those different terms, and it's a really important part of the future, I think, how we use language but not allow language to become a barrier. So I'm not going to talk much about the history, but the Commission, as you know, and as John would have said, has a very long commitment since its foundation to the peer workforce. And the first Living Well that he would have talked about certainly articulated what was needed at that time in 2014. And in the development of that report and plan, what was needed to support mental health reform, including strengthening the peer workforce. And that included the implementation of a framework for the New South Wales public mental health consumer workforce, as it was known then, and also identified, and we had some really good examples of peer workers working in other settings. And we've still got a long way to go on that front. So in 14-15, the Commission, as John would have also mentioned, supported and developed the Peer Work Hub. There's some seats down here if you want to come down here. Yes. I hope you all know about the Peer Work Hub on the Commission's website. And I'm going to give, I think we've already given, being a sheet of links to projects that the Commission is doing that are on the website, so that you can all follow what is happening. If you haven't, I really do recommend that you get on the website and get the newsletter from the Commission and just stay in touch with the website and a whole lot of work that is happening. So in 1920, not going back that far, that is even before I was born, which is saying something. 5 years into the 10-year plan, the Commission was asked to do a midterm review, and I think many of you would have been part of the consultations we held in 2019 around what was working across the state and what needed to be improved. And then out of that, we produced the midterm review of the Living Well strategy, which I do encourage you to become familiar with, because it is the foundational plan for New South Wales and for New South Wales government agencies around the next 5 years of mental health reform. So it's really important that we hold everybody to account. And one of the great things that's happened is that the Commission is now represented. Catherine herself is on the Mental Health Task Force of Government, which is led by New South Wales Health but brings all the government agencies together and is the mechanism for holding agencies to account about their implementation of the Living Well reforms. And for the first time, we have regular reporting, annual reporting happening, and the Commission publishing a report. So if you haven't seen it, there's a great report from developed last year on the first year of the plan and what was happening. And we're just seeing a growing commitment to public reporting. It was a long time that really the agencies involved in the Mental Health Task Force were not publicly reporting. They would be reporting in their at a lower level in their annual reports, but this is about living well and reporting on all those pieces of work that are being done. We also, of course, publish on our website the indicators, and the indicators are really where the rubber hits the road in terms of how well people in New South Wales are doing. We can have a whole lot of projects going on and a whole lot of work happening with a lot of us bureaucrats, which is a good term, working away to create change. But unless we're seeing change on the ground in terms of people's lives being improved by what we do, then it's not worth much. So we do really take it very seriously the commitment to follow the indicators. So the Commission collects data. There's a lot of data that was initially collected by the Australian Institute of Health and Welfare. It's bumpy data because not all of it comes from an annual survey. It comes from a whole range of places. So it's bumpy, as I say, but it's an important way of seeing whether we are actually making a difference. And then, of course, we had bushfires and floods and COVID, and that is still, of course, very much still part of our community, isn't it? The challenge to support people's health and well-being through those really significant traumatic times. And so the Commission has also done some surveys. We did the first one in 2020 around the impact of COVID on people's mental health and well-being. And then they did another one in 2021, and that data is all up on the website as well. So there's lots of ways you can be well informed as you work to advocate for people and for systems to change. So that's one of my key messages, really get in there, tear the data apart, get to know what you can know about your own area of work, about your own agency and what it's committed to do, and then you're in a stronger position to hold up the flag and argue for the change to happen. So clearly much to grow the peer workforce is a core of all our reform plans, and it's very much alive and well in the Living Well in Focus, the midterm review. So that's sort of course, a given. If we don't do that, we're not doing much. So Action 11 in the strategic plan talks about government agencies are to continue, and that's not just health, of course. That's government agencies are to continue to build the consumer peer workforce and develop an agency strategy to guide those efforts. So wherever you work, there needs to be an agency strategy that you can access about building the peer workforce. And Action 12 states government agencies are to continue to build the carer peer workforce, because that's really, we have so far to go on that, and develop an agency strategy. So, that's the baseline, really. Keep building the workforce. To support these sort of actions, the Commission has a number of projects that you can see in the plan, and the Commission currently sponsors around 100 scholarships for people to undertake the Cert 4 in mental health peer work through the Mental Health Coordinating Council. And the peer workforce is, hooray, the fastest growing workforce in the mental health sector. And we believe that the nationally recognised qualification is a really important way to amplify the value that the mental health peer workforce can bring to the sector. So, as our colleague on my left mentioned, the Commission is doing also a number of specific projects around building the peer workforce, and one of the big ones is what we're calling the Peer Navigation Project. So we did a big project in 2020 that many of you may have been part of, that was really around getting under the skin of what do we need to do to support people to find the right care at the right time. Because, you know, our system is so big and complex. Health is big and complex. And once we add all the other agencies of government and think about the ways, and then the private sector and the Commonwealth sector and Medicare and all of that is a really complex system for people to navigate. And, you know, we sometimes say, well, you know, start with your GP, but we know that is still for many people very difficult, especially post and during COVID, to access a GP, to find a GP that you can access regularly. And then GPs themselves are, of course, a highly mixed and variable group of people, aren't they? They're bound to be. They're really small private businesses, and they work in very, very variable ways. And, you know, while many, I'd say hopefully most, have a commitment to doing the right thing, they are also struggling to stay in business, to stay afloat, because Medicare rebates have not really increased. So, you know, that system is fragile. The private system around other Medicare rebated services, you know, psychologists, social workers, hopefully we'll see peer workers in there too in the future. That's also very vulnerable post-COVID and has been under immense stress. So, you know, in terms of saying to people, oh, we'll start with your GP if you've got a mental health issue, you know, it sounds so simple. And I've been as guilty as anyone of saying, yeah, that's where we should start, but it's much more complex than that. So we did a big co-design project in 2020 with, I hope many of you may have been part of it, to look at how do we build a system that is navigatable for people. And in the end, through lots and lots of consultation, the core idea, and again seems so simple, that came out of that was to really strengthen the work that peer workers do as navigators and as soft entry points and soft referrers. Because, you know, it's all very well, go to your GP and then here's a mental health plan, here's the address of a psychologist, ring them up and make an appointment. Yeah, probably not going to happen. You know, if you have a peer worker linked in there, and we have seen some great pilot projects with peer workers working in GP practices. Some of the PHNs are funding pilot programs where they have a psychiatrist providing consultation psychiatry and peer workers working in the GP practice to be there in the waiting room. I don't know whether anyone here is doing that sort of work. Is anyone here doing it or know of it?
I was.
You were. Sorry, where was that voice from? Oh, right. Okay. So target that man at morning tea. Find him and talk to him more about it. It's a great model and it's something I hope we'll see more. I'm sorry you're not doing it now, but I'd love to talk to you at morning tea about how it went. But you know, peer workers in waiting rooms, I think, is just a fabulous idea and concept. And then having this idea that the peer worker is really well placed to be the navigator and to be provide the soft referral. And by soft referral, I mean that we don't just give you a piece of paper and a phone number, but here's the person who's going to help you to go and find that agency. If you want to see a psychologist, let's go together. Or you want to see another service, let's go together. Let's set up the appointment so that the referral process works smoothly, and people are not then frightened away, as many of us are, by a strange new place and a strange new person to talk to. So that whole model is being piloted now, and one of those pilots is with the AIDS Council of New South Wales, and that's fantastic. The Mental Health Coordinating Council, and Carmel might say more about it this afternoon, we've also got a project going with the Mental Health Coordinating Council looking at developing an additional elective, because this is what peer workers do, isn't it? You can all tell me about how that's the way you work or you try to work, but it's about having the authorising environment to work that way, because with funding barriers and arrangements, it's so hard to be able and to be authorised to spend time outside your agency, working across the road or with a different group of people. It's really hard pressure, isn't it? So we really want to find the way to authorise and support peer workers to work in this way, and to be the soft navigators. And so we've got these 4 pilots going. One is ACON, I'm sorry, I didn't get your name. Brit. Yes. So Brit is the person to talk to at morning tea if you want to know more about that one. But as I understand it, it's called the P4T. Is it? You're in a different part of the... Yes. Okay, I won't target you then to... So the P4T pilot program at ACON provides trans peer navigators to support people who are transgender, and how important is that in the current environment, and provides a video telehealth service to help connect transgender people with support and services. Marathon Health, is anyone from Marathon? Marathon Health has some pilot in this area to support Aboriginal girls and women aged 16 to 35 in Condobolin. So there's been a lot of problem with young Aboriginal women being able to be connected to services and feeling like they were being effectively engaged by the services. I'm very anti the term people aren't engaged, because it's always, in my view, the services' responsibility to engage people, not the consumer's responsibility to be engaged. So I'm very focused on that sort of language. Language does matter. So Western New South Wales Local Health District has got some peer navigators in Warren and Coonabarabran, working to improve health literacy and support people to navigate local networks, particularly Aboriginal people. And I was talking to Western New South Wales on Monday last week, and they were telling me how well that's going, and how really they are being able to effectively link some of these young women particularly to services and make the connection work for them. And in South East Sydney Local Health District, there's peer navigation happening for people accessing St George Hospital, and particularly focusing on helping people post-discharge, because we know how important that link is. And I know many of you were probably working in the suicide prevention space, and how important that little link is to the post-hospital service. So, we really think peer navigators can be, again, the process and the way in which that soft referral can happen and really hopefully stick and support the person. So our learnings so far are being captured in a defined scope of practice for peer navigation. It's being developed, I don't know whether it's up on the website yet, but it will be. And as I said, we're working with the Mental Health Coordinating Council to potentially develop an elective around this to go into the Cert 4 in peer work. So I mentioned the COVID survey. We've also, there's a whole lot of other work that you can read about on the Commission website, but I want to just move to talk a bit more about, and I don't know how I'm going. Oh, have I got 5 minutes? Oh, thank you. It helps to look in the direction of the facilitator, doesn't it? Yes. So what role do I see for peer workers in the future, and how are we going to get there? Absolutely, we need to be doing that baseline work of continuing to build. I know Peter will talk about what we did in Flourish with Janet Ma and Faye Jackson's leadership, was create a program that basically in our recruitment we turned the question around and we said, why not a peer worker? So if you're advertising a role, why shouldn't it be a peer worker? Rather than, oh, let's try and get a peer worker for this job. No, the first question is, why couldn't it be a peer worker? So I'm sure Peter will talk some more about that and how that's going. So, that's the sort of shift we need to make. So of course I see peer workers continuing to grow and be part of multidisciplinary teams in the health sector. And I've just had the honour of being appointed to the board of the Nepean Blue Mountains Local Health District. So I'm reared up and fighting, ready to go, working with the leadership, the mental health leadership and the LAC leadership out there around how we can, be a bit of a flag flying in this area for mental health. But I do see we've got some work to do around multidisciplinary teams and building the knowledge and understanding of clinicians and other people in the team. So that's something that I think health needs to do and other government agencies need to do to really build the knowledge and understanding, because I do hear war stories about peer workers not being understood and appreciated by other members of the team. I also hear some great stories where they are. And so the peer workforce is growing, as I said. The numbers, it's hard to pin down. But a 2021 survey estimated that the community sector peer workforce was about 394 headcount, and a much smaller number of carer peer workers and some recovery coaches. But estimated that peer workers make up about 14% of the community managed mental health sector workforce now. So Carmel probably and Peter and will have more probably better figures on that. So trending upwards is great. Where peer work is in all the plans. It's in the national plan, the National Mental Health and Suicide Prevention Plan, and the productivity inquiry certainly focused on it. It's in Living Well. So what else do we need to do? Well, I don't know how many of you have been part of discussions about a peer worker association or a professional body for peer workers. Has anybody been part of those discussions? Yes. Are you going to talk about that?
At the Themes Conference in previous years, Tim Heffernan has done.
Yes, but we need to fire it up a bit, don't we? We need to see some more active discussion around it, because I think it's one of the things that can really, really help to promote. When I worked in housing many years ago, I was part of developing a professional body for housing workers. They were a bit like peer workers. They came from a variety of backgrounds, and they had done a a program, a course, on top of lots of different qualifications, but they really needed the support of a professional body. And so while the Commission doesn't have a formal view on that, I have a view. And and there I'm not speaking on behalf of the Commission. But I know the Commission is supportive, but it's really up to you as the peer workers. You need to make that happen, because it's not up to us to say whether it's a good idea. It's up to you to find the value in it and get it happening, because I do think it can provide a huge boost to the development and to the perception of peer work by other professions. You know, having a professional body that can speak for you, that can be developing the training, promoting the mentoring, the exchange, you know, all of those things that build a professional body. We need to see growth in the other government agencies. So I think that's something that the Commission can very actively pursue, is to really ramp up. But there is tremendous opportunity, particularly in community services, in justice, in all those, in education, to support mental health and wellbeing programs with a peer work stream of workers. So again, you know, money's tight, we know all those arguments, but we need to just keep picking away. Finally, I think there's a lot more I could say, but I did want to, I'm probably completely run out of time. I do think there's a challenge for all of you and for being that I wanted just to mention, because we talked about language, and I said it's really important that language bring us together rather than dividing us. And I have been really a bit concerned at a personal level to see a little bit of splitting of the peer workforce happening over the last few years as new areas grow and develop. And I absolutely understand why we need to have special focus on different aspects of the role, but I do implore you all to think about what you have in common and build that commonality, that professional commitment. Doesn't matter that people work in different areas, they're going to have different areas of focus in their work, but bringing together is what gives strength. So being inclusive, and I think being has a real role here to, as the advocate, as the peak body, for consumers in the sector, to really think about how do we bring that diversity, how do we bring that inclusiveness to everything we do. And my final comment is the census is out from last year, and there's so much information in there for us. So again, grab hold of the data. Data really is power. And one thing I wanted to, as I look around the room, I do see diverse faces, but I think about the fact that now in Australia, over 50% of our population was either born overseas or has a parent born overseas. So I think about what is happening to the mental health needs of that part of our population, and are we doing enough to attract and grow peer workers who understand those issues and who are able to represent that part of our community. So I will stop there, and if I've got any time left, I'm happy to take questions. So thank you very much for the opportunity. I do wish you all the best. Yes, there's a question up the back.
I'll say Pam Rutlidge, Ryan, but when it comes to a national body, I think what's been lacking is to form a high-level committee so that all peer workers of government can actually receive an email or source to understand what that actually means, because Tim, Heffernan and a few others we talked about for a long time, it hasn't happened, but we haven't actually had in a format of how that should look. Right.
Yeah, well, I think, there's a number of bodies, aren't there, and that are doing part of the work or potentially doing part of the work. It's a question about how you bring them together, I think, to say this is bigger than all of us. how do we really get that focus? Peter might be going to talk about that. Are you?
There's also more room for government to provide some initial funding.
Right.
Peak body or national association
Yep.
of peer workers, because we need some initial funding to begin with.
Yep.
Until such time as
It becomes sustainable. But yes. Yes.
Could I just repeat that one, because I want so the Mike can sort of pick up the question. So it was a question
Okay.
around additional some government funding to get it started. Yeah. Yeah. Cool.
Yep.
Sorry, Pam.
Yep. Yeah. So I think I don't know how far it's got. I haven't been, as I say, I haven't been focused on it recently. But there needs to be a business case for that. To argue that case, and to argue the costs and benefits, and the benefits are huge, as I said. So
maybe some work will be done at this year's Themes Conference when a lot of the peer workers from all over the states
and Australia, yeah,
together.
yep,
Maybe have a meeting to talk about some of these issues.
yeah. That's something to raise with. I don't know where Thames is this year or Sydney. Oh, there you go.
12 to 14 with Consumer Day on the 11th.
Excellent. Thanks, Peter. Yes.
Hi, my name's Rua. I'm Indigenous from New Zealand and Aotearoa, and also part of the trans community. So
Fantastic.
just a question. I'm just curious to know what sort of processes or pathways exist within the Commission for peer workers in one of my roles.
Right.
I'm an advocate across different organisations. Some
Yes.
for peer workers who have suffered incredible stress or bullying from CEOs or management or HR. What sort of pathways could they have to support advocacy through
Yeah.
our Commission when things go wrong?
Right. Yes. It's a challenge, because it's really, the Commission is very small. It's 20 people. It's a very small organisation. It really doesn't have in its charter a role around that sort of managing, or supervising HR practice in agencies. That's really a matter for the agencies. But I think there's potential to make sure that information is there. But I don't have an answer from the Commission's own role.
I thought that there might be some support in advocacy because this is my 7th year, but I've been quite horrified at what I'm seeing.
Right.
One of my colleagues has about 100 people that have been affected peer workers since 2010. Probably about 10 of that actively.
Right.
And there's no space, apart from going the legal route, there's no space for support and advocacy at a high level.
Right. Is this within health? Is it? No, not within health.
As well, but
Right.
whether the Commission would consider that to be
Yeah.
peer workers who have been really affected.
I think the Commission would probably be interested in how to ensure that there is a system to deal with it, but not to directly deal with it itself, because it just wouldn't have the resources. But we can talk about it over morning tea. I'm happy to sort of provide some advice.
So you're still around for morning tea?
I'll stay for
That'll be
morning
great.
tea, most
That'll be
definitely.
fine.
Yeah.
All right, beautiful. So we've got, I think Fayaz has a comment, and then we probably should wrap up Q&A and move on.
Just a quick one. Thank you for the suggestion, or the recommendation rather, for forming a professional body. Something which has been on our mind, that's being, and we will certainly proceed with some discussion with the ministry and maybe form a committee from amongst the team here and work towards maybe forming what
I think
could be.
I think it's I certainly think being has a role to support it, but it is the peer workers
Yes.
who need to make it happen. So
That's right.
I think Peter's idea of getting it discussed at Thames, where there might be a big, broad group of, because it's again not up to the Commission,
Yeah,
or being is it really a support? I would think.
Yeah. It has been in our mind.
Yeah.
All right. Well, thank you very much.
Thank you. Thanks again.
Thanks again. All right. Round of applause. Thank you.